The next point is FENGCHI, GB20. So this is a frequently used point, and it is located below the occiput. So the occiput is just the back of the head, in the depression midway between FENGFU, DU16 over here, and WANGGU, GB12, which is just posterior and inferior to the mastoid process, and is around here. And then it's in the depression between the trapezius muscle and the sternocleidomastoid. So here's the trapezius muscle here on the image, and here's the sternocleidomastoid, which runs to the anterior portion of the body. And between these two muscles, there is a depression, and this point lies in this depression. So the indications, it can be used for apoplexy, epilepsy, headache, dizziness and tinnitus, deafness, and other diseases caused by internal wind. And this is because this point is known as wind gate, and it is a very important point in treating conditions caused by wind. It can also be used for common cold, nasal obstructions, epistaxis, allergic rhinitis, and redness with swelling and pain of the eyes. Furthermore, it can be used for deviation of the eye and mouth and other diseases caused by external wind. So you can see it can be used for internal wind conditions and external wind conditions. And then finally, because of its location, it can be used for pain and rigidity of the nape. Needling is oblique inferior insertion, 0.8 to 1.2 tsun, towards the tip of the nose. So you're going to angle the needle towards the tip of the patient's nose. Or you can do a horizontal insertion towards DU16, which would be this way. One caution here is that the medulla oblongata is deep to this point. So you must pay close attention to the angle and make sure it's going towards the tip of the nose and how deep you're inserting, that you don't go deeper than 1.2 tsun. The next point is JIANJING, GB21. So this point is located midway between that joy, DU14, and the tip of the chromium. So here's that joy over here, and the tip of the chromium is this part over here. So we take this distance and we divide it in half, and then we go to the high point of the muscle over here. So this point's indications, firstly related to its local area, it can be used for pain and rigidity of the nape, pain of the back and shoulder, and motor impairment of the upper extremities. It can also be used for dystocia, mammary abscesses, agalactia, which is absence or reduced flow of milk, and breast nodules. And it can finally be used for scrofula. Needling is perpendicular insertion, 0.6 to 0.8 tsun. And the caution here is you've got to be careful not to do deep insertion on this point, as because of its angle, it's going towards the lungs, so they lie deep to this point. And remember that this is a frequently used point. And it can be useful to combine this point with small intestine 11, Tianzong, and small intestine 1, Shaozi, for mastitis. Or you can combine this point with Ren 3, Zhongji, and we use boxibustion on both points to facilitate discharge of the lochia. The next point is YUANYE, GB22. So this point is located at the mid-axillary line, this line over here, and it's in the fourth intercostal space when the arm is lifted. So you'd raise the arm and then you'd count down into the fourth intercostal space. This point can be used locally for fullness sensation in the chest, pain and paresthesia of the hypochondriac region, which is this region nearby, and then also for pain in the upper limb, swelling of the axilla, and pain in the back and shoulder. Our needling is either oblique or horizontal insertion, 0.3 to 0.5 tsun. And then the caution here is against deep perpendicular insertions or deep oblique insertions, as both of these could penetrate the lungs. The next point is ZHEJIN, GB23. So this point is located 1 tsun anterior to YUANYE, GB22, which is about here on the image. And it's still in the fourth intercostal space. So we got to find the mid-axillary line, locate GB22, and then we're going to go 1 tsun anterior along the fourth intercostal space, and that's GB23. The indications for this point, it can be used locally for fullness sensation in the chest or polypnea. It can also be used for vomiting and acid regurgitation and pain in the hypochondriac region, and then swelling of the axilla, which is also local, and pain in the back and shoulder. Needling is again oblique or horizontal insertion, 0.3 to 0.5 tsun. And for both of these points, we usually go along the interspace. So if you're directing it posterior, it would be this way, or anterior this way. And then again, the caution against perpendicular insertions or deep oblique insertions, as both could penetrate the lungs. The next point is RIYUE, GB24. So this point is the front mu of the gallbladder. And it is located on the anterior chest wall, so that means it's more on the anterior portion of the body, and it's below the nipple in the 7th intercostal space. So we're going to count down to the 7th intercostal space, and it's 4 tsun lateral to the midline. So that's along this 4 tsun line that runs from the clavicle down along the nipple and all the way down the abdomen. So this point, because it's the front mu of the gallbladder, it can be used for conditions of the gallbladder, but also conditions of the liver, because these organs are a ZHEJIN pair. It can therefore be used for conditions such as jaundice and distending pain of the hypochondria. It can also be used for vomiting, acid regurgitation, and hiccups. Needling is oblique or horizontal insertion, 0.5 to 0.8 tsun. And then the caution here is against deep perpendicular insertions or deep oblique insertions, as both of these could penetrate the lungs. The next point is JINGMEN, GB25. So this point is the front mu of the kidneys. So the function of front mus is similar to the function of back shoes. It gives the point additional functions on the corresponding organ. So like the front mu of the kidneys can treat conditions of the kidneys. And the location of JINGMEN is below the lateral aspect of the rib cage. So it's on the lateral side of the body, and it's anterior and inferior to the end of the 12th rib. So you've got to count the ribs down to the 12th rib over here, and then we're going anterior and inferior, and that's JINGMEN. And this is similar to the location of JIANJING, liver 13, which is at the free end of the 11th rib. So you must not confuse these 2 points. The indications for JINGMEN, so because it's a front mu of the kidneys, it can treat conditions of the kidneys, such as dysuria, edema, and other metabolic disorders. It can also be used for abdominal distension and borborygmus, diarrhea, and finally it can be used for lower back pain and pain of the hypochondriac region. Needling is perpendicular insertion, 0.3 to 0.5 tsun. The next point is DAIMAI, GB26. So the location of this point, it's anterior and inferior to the free end of the 11th rib, and it's just below liver 13, JINGMEN. The indications, it can be used for irregular menstruation, amenorrhea, and leukorrhea. It can also be used for hernias, lower back pain, and pain in the hypochondriac region. The insertion is perpendicular, 0.5 to 0.8 tsun. The next point is WUSHU, GB27. So this point is located anterior to the anterior superior iliac spine. So the superior iliac spine is this part here, and we've got to be at the anterior portion, which is here. And then we have to be 3 tsun below the level of the umbilicus. So you're going to go 3 tsun down from the umbilicus, and then you're going to go lateral till you're just anterior to the iliac spine. This point can be used locally for irregular menstruation, prolapse of the uterus, and leukorrhea. It can also be used for hernias, and then lower back pain and abdominal pain. Needling is perpendicular, 0.5 to 1 tsun. The next point is WEIDAO, GB28. So this point is 0.5 tsun anterior and inferior to WUSHU, GB27. So GB27 is over here, and we've got to go 0.5 tsun inferior, so that's below, and then anterior is this direction. Because the abdomen is a circle, this point is slightly anterior to this. But you could also say 0.5 tsun medial, because it's also more medial than the previous point. And it's over here. The indications, it can be used for irregular menstruation, prolapse of the uterus, and leukorrhea. It can also be used for hernia, lower back pain, and abdominal pain. The insertion is perpendicular, 0.5 to 1 tsun. The next point is JULIAO, GB29. This point is located on the lateral aspect of the hip. So that's this region, and it's at the midpoint of the line between the anterior superior iliac spine over here and this apex of the greater trochanter. So this is your greater trochanter, and you're going to feel the high point over here, And then we're going to find the midpoint between these 2 points. So if we draw a line like this, and then it's here on the midpoint of this line. So this point can be used for pain of the lumbar region and leg and paralysis, and hernias, and also for pain of the lower abdomen. Needling is perpendicular insertion, 1 to 1.5 cun. So this is slightly deeper insertion than most points, and that is because this is getting to the large muscular areas of the body. The next point, HUANTIAO, GB30. So this point is on the posterior lateral aspect of the hip. So that just means it's on the back and the lateral side. And this point is found by getting the patient to lie on their side and bend the patient's hip joint. Then this point can be found at the junction between the lateral third and the medial 2/3 of the distance between the greater trochanter over here and the sacral coccygeal hiatus. So 2/3. So you're going to divide from here to here into 3 equal portions like this. And then there's 2/3 on the medial side, so 1, 2, and 1/3 on the outer side. So that leaves the point over there. This point is often used for lumbosacral pain, numbness and pain of the lateral aspects of the lower extremities, and hemiplegia. It can also be used for rashes. Needling, so this is one of the points that we can go the deepest on. It's perpendicular insertion, 2 to 3 cun. So this will also depend on the size of your patient's hips. This point is also one of Madayang's heavenly star points, which means it's one of those 11 essential points that he believed every practitioner needs to know. And then it's also a frequently used point in clinical practice. The next point is FENGCHI, GB31. So this point is on the lateral aspect of the upper leg. So we're on the upper leg and we're on its lateral aspect. And we're directly below the greater trochanter. So here's the greater trochanter. We're directly below that. And we're 7 cun above the popliteal crease. So you're going to divide this space. And this space is 19 cun. And then you 7 cun above here. And the simple way we find this point is we normally ask the patient, either if they're standing or they're lying on their back, you can ask them to reach their hands down at their sides. And the point where the middle finger touches on the leg, that is this point. So if you look at the image here, it illustrates what I've just said. The indications, this point can be used for numbness and pain of the lateral aspects of the lower extremities over here. It can also be used for paralysis and hemiplegia. And then general pruritus. And can anyone remember what pruritus is? So this is itchiness of the skin. And this is a frequently used point, and the insertion is deeper than most other points. The insertion is perpendicular 1 to 1.5 cun. And this is not as deep as points on the gluteal region, but it's still fairly deep as this area is still quite muscular. The next point is Zhongdu, GB32. This point is on the lateral aspect of the leg. We're now 2 cun directly below FENGCHI, GB31. That means we're 5 cun above the transverse popliteal crease. The indications for this point can be used for atrophic debility of the lower limb and paralysis. Needling is perpendicular, 0.7 to 1 cun. The next point is XIYANGGUAN, GB33. So this point is on the lateral aspect of the knee. So now we're further down and we're near the knee aspect. And we're 3 cun above YANGLINQUAN, GB34. So here's GB34 and we'll learn how to locate it now. But once you've located it, 3 cun superior is this point. And it's in the depression superior to the lateral epicondyle of the femur. So the lateral epicondyle of the femur is over here. And we've got to be in the depression superior to this. This point can be used for pain and stiffness of the popliteal fossa and knee, so that's its local functions, and also locally it can be used for paralysis of the leg and knee pain. Needling is perpendicular 1 to 1.5 cun, and this point is also frequently used. The next point is YANGLINQUAN, GB34. So this point is the Hertzian earth point of the meridian. It's also the influential point of the tendons. So remember the influential points. What these mean is that this point controls this aspect. So the influential point of the tendons is responsible for governing the tendons, and therefore this point can be used for any condition that affects the tendons. So this can be things such as stiffness or contraction of the tendons or any other condition. So this point is found below the lateral aspect of the knee. So here's the lateral aspect of the knee, we're below it, and it's 1 cun anterior and inferior to the head of the fibula. So this is the head of the fibula here. So you're going to palpate along the fibula until you find its head. And then you're going to go 1 cun anterior this way and 1 cun inferior this way. And it's in a depression that's located here. So this point can be used for jaundice, hypochondriac pain, bitter taste in the mouth, vomiting, and acid regurgitation. It can also be used locally for knee pain, numbness and pain of the lateral aspect of the lower extremities, and paralysis. And finally, it can be used for infantile convulsions. Also remember that it can be used for any condition affecting the tendons. Needling is perpendicular, 1 to 1.5 cun. The next point is YANGJIAO, GB35. So this is a she-cleft point of the meridian, and it's located 7 cun directly above the lateral malleolus. So this is the lateral malleolus here. We've got to go 7 cun above it. And it's on the posterior border of the fibula. So once again, you've got to palpate for the fibula over here, and then we're going to palpate downward until we get 7 cun above the lateral malleolus. The indications for this point, it can be used for epilepsy, mania, clonic convulsions, fullness in the chest and hypochondriac region, and atrophic debility of the lower limb. Insertion is perpendicular, 0.5 to 0.8 cun. The next point is YUANYE, GB36. This is also a she-cleft point of the meridian, and it's located on the lateral aspect of the leg, and it's 7 cun above the lateral malleolus. So that's exactly the same as YANGJIAO, GB35, the previous point, except this time we're on the anterior border of the fibula. So remember, YANGJIAO is on the posterior border of the fibula, and this one's on the anterior border. This point is used for similar things: epilepsy, mania, fullness in the chest and hypochondriac region, and atrophic debility of the lower limb. Needling is perpendicular, 0.5 to 0.8 cun. The next point is GUANGMING, GB37. So this point is a luau connecting point of the meridian. So this point is located on the lateral aspect of the leg, 5 cun above the lateral malleolus. So the previous 2 points were 7 cun. This one is now 5 cun above this lateral malleolus. And this one is also on the anterior border of the fibula, just like the previous point. So the indications, so remember that this is a luau connecting point, which means that this point can treat both the interior and exterior related meridians, and thus can treat both the liver meridian and the gallbladder meridian, and thus can especially treat eye conditions. And that's why you can see from the first set of indications, and it's used for eye pain, night blindness, myopia, and presbyopia, which is the age-related decline of the eyes. This point can also be used for pain in the chest and breasts, and numbness. And thirdly, it can be used for pain of the lateral aspect of the lower extremities. Needling is perpendicular insertion, 0.5 to 0.8 cun. The next point is YANGFU, GB38. This is a Jing river and fire point of the meridian, and is located on the lateral aspect of the lower leg, this region. And it's 4 cun above the lateral malleolus. So 37 was 5 cun. This one is 4 cun above the lateral malleolus, and it's on the anterior border of the fibula. So this is the anterior border, and it's 4 cun above the lateral malleolus over here. This point can be used for migraines, pain of the outer canthus of the eye, pain and swelling of the throat, swelling of the axilla, fullness and pain in the chest and hypochondriac regions. Can also be used for scrofula and atrophic debility of the lower limb. Needling is perpendicular insertion, 0.5 to 0.8 cun. The next point is Shaoyang, GB39. So this point is the influential point of marrow, and it is located above the ankle joint. So here's the ankle joint, 3 cun above the tip of the lateral malleolus. So here's the tip of the lateral malleolus. We're now going 3 cun above, and then it's on the anterior border of the fibula. So let's bring in an image showing the fibula more clearly, and we've got to still be on the anterior border. So that's over here. The indications, this point can be used for dementia, apoplexy, rigidity of the nape, chest and hypochondriac pain and fullness, numbness and pain of the lateral aspects of the lower extremities. Needling is perpendicular, 0.5 to 0.8 cun. The next point is WUSHU, GB40. So this is the yuan source point of the meridian, and is located at the ankle joint In the depression anterior, so here's the ankle joint, we're finding the lateral malleolus, and then we've got to go anterior and inferior to it. And it's in the depression that lies here. The indications, this point can be used for redness with swelling and pain of the eye, corneal cloudiness, pain of the nape, subaxillary swelling, chest and hypochondriac pain, and pain of the external malleolus. So that's local pain. And then it can also be used for foot drop or foot inversion. Needling is perpendicular, 0.5 to 1 cun. And remember, this is a frequently used point. The next point is ZULINQI, GB41. So this is a shoestream and wood point, and it is also the confluent point of the belt vessel. So the location of this point, it is located on the dorsum of the foot, so that's the top portion of the foot, in the depression distal to the junction of the bases of the 4th and 5th metatarsals. So what this means is the base of the metatarsals, if you remember from previous slides, this is the head of the metatarsal and this is the base. So we're in the depression distal, so that means this way, from the two bases of the 4th and the 5th metatarsals over here and here. So we're going to palpate for these two bases, and then we're going to come distally until we find the depression just distal to the bases. And this is normally on the lateral side of the tendon of the extensor digitorum longus. So here's the extensor digitorum longus, and as you can see, we're just lateral of this branch. Next, let's look at the indications. So because this point is a confluent point of the belt vessel, this means that it can treat conditions along the pathway of the belt vessel. So let's bring in an image to show you where the belt vessel flows. So as the name suggests, this point flows around the waist just as a belt would. And the indications are, firstly, it can treat migraines, pain of the outer canthus, pain in the hypochondriac region, and pain of the dorsum of the foot. This is due to its location and that it is the point on the Gall Bladder meridian. Then because it's a confluent point of the belt vessel, it can treat irregular menstruation and acute mastitis. And then it can also thirdly be used for scrofula. Needling is perpendicular insertion, 0.3 to 0.5 cun. The next point is DIWUHUI. This is GB42. This point is located posterior to the 4th metatarsal phalangeal joint. So what this means is this is the joint between the metatarsals, these bones over here, and the phalanges, these bones over here. So we had the metatarsal phalangeal joint, and this time we're posterior to this joint. So here's the metatarsal phalangeal joints, and we're going this way, posterior. And it's between the 4th and 5th. So here and here. It's on the medial side of the tendon of the extensor digitorum longus over here. The indications, this point can be used for headache, pain in the outer canthus, pain in the hypochondriac region, and pain on the dorsum of the foot, so that's its local function. It can also be used for deafness and tinnitus and acute mastitis. Needling is perpendicular insertion, 0.3 to 0.5 cun. The next point is XIAXI, GB43. This is the Xing spring and water point of the meridian, and is located proximal to the margin of the web between the 4th and 5th toes. So here's the 4th and 5th toes on this image, and here's the web between them. So we're proximal, which means towards the center, so it's this direction, and we're at the junction of the red and white skin. And the indications for this point, it can be used for palpitations, headache, vertigo and swelling of the cheek, tinnitus, deafness, redness with pain of the eye, and other diseases of the face and 5 sense organs. It can also be used for pain in the hypochondriac region, pain in the knee and thigh, and pain locally on the dorsum of the foot. Fourthly, it can be used for acute mastitis, and finally, it can be used for febrile diseases. The insertion is perpendicular, 0.3 to 0.5 cun. The next point is ZHEJIN, GB44. This is the jingwell and metal point of the meridian, and is located on the dorsum of the 4th toe, 0.1 cun lateral to the corner of the base of the nail. So here's the base of the nail, and we've got to go lateral, 0.1 cun lateral to this. So that's why the point is over here. The indications for this point, it can be used for headache, swollen eyes, tinnitus or deafness, redness with pain of the eye, sore throat, and other heat syndromes of the 5 sense organs. It can also be used for pain in the chest and hypochondriac regions and pain of the dorsum of the foot. Needling is a shallow perpendicular insertion of only 0.1 cun. So that's the end of the gallbladder meridian. The next meridian we'll be looking at is the liver meridian of the foot